Good morning and thank you for the kind invitation. As the president of the roundtable commented very well, 3 years ago I presented my first results of laser iridoplasty. Pioneers worldwide after 2 years of experience, we were then focused on studying the safety, efficacy, and predictability of the technique. In 2014, I presented the good recovery of vision and eye pressure after laser sessions. Also performed anatomical studies with computer tomography which demonstrate the integrity of the iris and verified that there was no damage of the endothelial cells of the cornea with studies of specular microscopy. Finally, I presented analysis of Gonioscopy that ruled out that the laser could generate chronic pigmentary glaucoma because the camerural anger appeared free of pigment. And we arrive today 3 years later in which I will present the research and innovative developments that we have carried out at EYECOS Clinic. Now they are results after 5 years of experience. In the bibliography it is described that all eyes have the same percentage of melanocytes and the same amount of pigmented granules. Therefore, the color of the eyes is determined by the type of the pigment. Eumelanin is dark brown, pheomelanin is light brown, and lipochrome is yellow. So in 2014 we set new ambitious challenges. First of all, to demonstrate protection against UV rays, also in order to reduce complications, to better predict cosmetic results, and to obtain an objective assessment of the color of the eyes. And for this we started histological, pathophysiological, pharmaceutical, fluid dynamics, genetic, and photographic studies. Among the advances we have achieved are new medical protocols, innovative drugs, mobile applications, new genetic tests, photographic techniques, diagnostic equipments, laser enhancements, and a remote diagnostic protocol. On the left, we see my classification of ocular pigment, which consists of 4 degrees from lowest to highest concentration of melanin. In fact, we continue to use it because it is simple, useful, and practical. To the right, we can see histological samples of cadaver iris where the effect of the laser can be seen. The posterior dark pigment can guarantee the protection of the UV rays. We have performed studies of physiology and fluid dynamics through pneumotonography, thanks to which we have understood how the removal of the pigment released after the laser is carried out and which drugs can help us in this process. We have introduced new drugs, among which we highlight artificial tears with low concentration of sodium heparin and inhibitors of melanin production. Also, we have incorporated special medications for eye pressure control and pupil size management into our arsenal. We have also been warned of the side effects of eye drops with prostaglandins, commercial name Latisse, used to lengthen the eyelashes. As you can see in this publication, a famous American actress suffered this problem after its use because she didn't know this side effect completely. In fact, his eyes quickly became dark brown after a few months. This application serves to predict the final result. It's based on the phenotype of the patient and his parents, and also the application informs us of both the color and expected tone. In addition, you can get a real simulation from a selfie. The new genetic test from a sample of saliva or blood that managed to identify the eye color genes, and we also recommend performing the genetic screening test for glaucoma. Because of how difficult it is to get good eye shots, we have described simple photographic techniques to capture well-focused and lighted images. They can be done with a helper or through a selfie. The main goal is to facilitate the remote diagnosis and follow-up of patients as well. without the need to go to the clinic. EYECOS has developed the first iris scanner analyzer, a new diagnostic tool essential to objective assessment, and also laser improvements with engineering industries. Now I'll spend a little time talking about the iris scan, which has warranty as the objective and detailed diagnosis of the iris. Before iris scan, everything was subjective opinions that made our work very difficult. Through tomography and topography techniques, we have been able to obtain color, contrast, and pachymetry maps of thickness, 3D topography, total diameters measurements, photodynamic pupillometry, a battery of physiodynamic data, and finally comparative studies of evolution before and after the laser. You can see one of the first prototypes, the tab of the patient, a typical example of iris study. Now an analysis of a grade 1 patient, another case with very little pigment. Here a level 2 eye with green and light brown color. A level 3 patient with a uniform light brown. And finally, a level 4 patient with a really very dark pigment. We are optimistic about the future for many reasons. The eyes are the most important organ of sense since they receive more than 90% of the information from the outside world. They also play a role in the transmission of power and emotions, as we can see here. Regarding the potential market, it is huge because only the 2% of the world population lacks melanin in their eyes. A main chapter is the pathological indications of laser iridoplasty, heterochromia. Here we see a lady who was born with her left eye brown level 3 while her right eye was blue. And here we can see how both eyes matched after the treatment. So the left changed from brown to light blue. On the left we can see an example of large nevus before and after the treatment, and on the right another case of congenital heterochromia. But we can also have to deal with cases of traumatic after surgical procedures and partial heterochromia. On the left, you can see a woman with full heterochromia after a congenital cataract surgery, and in the middle, two partial cases of heterochromia. In the middle, a multinevus, and to the right, a secondary to prostaglandin treatment. Now, how changed the multinevus before and after the treatment? But the most frequent indications are cosmetic, caused by a lot of reasons: job, family, psychological. Now I'm going to show you a series of cases before and after of cosmetic indications. These are our usual results. In this image at high magnification, the difference between the untreated tissue, already blue, and the still untreated dark brown can be perfectly appreciated. I will show you more examples at a high detail. As you can see, we almost always leave a thin crown around the pupil untreated for safety reasons, since the lens is very close and we cannot risk damaging it and causing a vision impairment. As a main conclusion, after more than 5 years of experience doing laser iridoplasty, we can confirm that it is a safe, effective, and predictable technique. It causes few complications and they are well solved, and the cosmetic outcome is always natural and discreet. However, we need more studies in the long term. As general requirements, we should only admit adults and healthy, with no psychiatry history, no additions to drugs, steroids, or anabolic hormones, because predisposing to chronic glaucoma, and without autoimmune disease, since the iris is the reflection of all immunological disorders. Among eye requirements, we must reject personal and family history of glaucoma, any signs of uveitis, do not treat patients with high refractive errors, and finally only accept levels 1, 2, and 3. Patients with psychiatry disorders must be rejected. Sometimes we have heard requests for treatment in order to improve deep depressions, even after suicide attempts. And finally, I want to introduce you the Iris Workstation, which is the essential laser platform for permanent laser eye color change in a safe, effective, and predictable way. Thank you very much for your kind attention.